my colleagues and I, and this included a statistical group in Boston, as well as interested investigators at the company Biohaven, plus Dr. Peter McAllister, we were interested in investigating placebo response over time in migraine preventive trials, and also interested in whether the outcome measures had made a difference. And the issue was that there have been peer-reviewed articles that support increasing placebo response over time in other neurological conditions. The evaluations in migraine were equivocal, and the critical question was whether there's a change in the difference between the active treatment and the placebo group. That is a specific treatment effect, because if placebo rate is going up, then the difference between the active and the placebo, the specific treatment effect will go down. And that has tremendous implications in terms of doing clinical trials and figuring out whether something works in neurology and specifically in migraine. What we did was a very comprehensive literature review from January of 1990 to August of 2021, using large bibliographical databases and using risk of bias and quality scales and tools to really set standards for the randomized control trials that we could evaluate. And just to give you a feel for how difficult this is in terms of quality of the studies, we started off with 1,455 studies and ended up with 54 studies initially and an additional 30 that we were able to evaluate. The reason that there was a change was that we first evaluated specific outcome measures of monthly migraine days, migraine headache days per month, migraine attacks per month, migraine episodes per month, and subsequently we analyzed for migraine days, attack frequency, headache days per month, and overall headache days. We also did something that we thought was really important, and that is that we looked at these outcomes as continuous variables rather than dichotomous variables, because that's stronger from a statistical standpoint, and we thought it might give us a little bit better feel. And then finally, we divided the studies into oral studies, that is where the placebo was oral, and injectable studies where the placebo was injectable. And what we found initially was that for oral placebo studies, over this long period of time, with the first 4 outcome measures, it was very clear that placebo response had increased. It turned out harder to show whether placebo was going up with injectable placebo. And we saw numerical trends, but we didn't find statistically significant trends. And the same thing was true when we added all of the placebo-controlled studies for prevention of migraine together. That is, when we added both oral and injectable together, we saw a positive but not significant relationship between the publication year and the mean change in migraine outcome from baseline in the placebo. So what we ended up doing was doing the 8 outcomes with all of the placebos, oral, injectable, and intravenous. And when we did that, we saw a very significant positive correlation, increasing placebo over time. Now, that's not a good thing. That's not a good thing, because an increased placebo response leads to a decreased efficacy difference between the placebo and the active. And that means, from the standpoint of studying migraine, we need larger sample sizes in powering future clinical trials. And also, if you're going to do a meta-analysis of migraine over time, you have to bear in mind that the placebo response is going up, and comparing the effectiveness of preventive migraine therapy now compared to previously, one has to take into account this increased placebo response. A neurologist might ask, why is the placebo response going up? One possibility is heightened expectation from the patients, so that the placebo response goes up. Another is that participants in randomized control trials receive a lot of attention, so that maybe the intensive contact with the clinical staff produces positive effects. But we clearly have some work to do in terms of figuring out why the response is going up and responding to that for future clinical trials.